Hi guys, my name is Sanjay Gupta. I'm a consultant cardiologist in New York. Today I wanted to talk about atrial fibrillation, and in particular I wanted to talk on the subject of acupuncture and atrial fibrillation and whether acupuncture works for atrial fibrillation. So um, let me just talk you through how I got to this because I'm a traditional cardiologist. So I've never really been into acupuncture, but I wanted just to talk to you about my sort of thought process and it'll make sense. To my mind, the only two reasons we give medicines are one, to make people feel better, i.e., improve their quality of life, and B, to make people live longer, ideally. Now, when you are giving someone something which purports to make people live longer, the truth is you need evidence because as an individual patient, how do you know that by taking this particular medication you will live longer? We don't know because we don't know how long we're going to live. We're only going to find out how long we've lived after our lives are over. So just by taking something where someone says, oh, if you take this and then you won't have this, that's not true. You don't know. You don't know whether you would have had it if you didn't take the tablets. You don't know whether, you wouldn't have had it despite taking the tablets. So um, when we are dealing with length of life and treating length of life, we need evidence. And we need evidence from a population of patients, just like the patient in front of us, to say, well, if we give this whole population this medication, then does this population tend to live longer in general? Not everyone will live longer, but a small number will probably outlive a population of similar patients who are not on the medications. And then we think, okay, well, if we can treat as many people as we can, maybe some of them will get that benefit. But the benefits are generally small. When it comes to quality of life, on the other hand, you don't need that evidence. Why? Because quality of life is an individual thing. You can measure quality of life, and everyone has their own way of measuring quality of life based on their expectations, based on their values, etc. So, what is my expectation for my quality of life may be very different from another person. So, the only evidence I need when I'm taking things for quality of life purposes is to see whether that thing makes my quality of life better. And if it does, and it doesn't carry with it any risk, and it isn't exorbitantly expensive, and it makes my quality of life better, then it's worth doing, right? So, there is a mistake where doctors say, oh, there is no evidence that this works. Well, actually, how do you know? I can do it if it's not harmful, and if it actually makes me feel better, then it works for me. So if someone comes to me and says, look, every time I pray, I get less AF, then I think it's completely wrong of me to say, well, there's no evidence that prayer works in AF. It works for you. So if it works for you, it works for you. And you should do it. So this is how I started thinking about quality of life. And, I get a lot of patients who turn around to me and say, look, my quality of life from AF, where my AF comes and goes, where I'm getting paroxysmal AF, is horrible because I understand that my length of life is issue is covered with anticoagulants, that I'm reducing my likelihood, hopefully, by taking an anticoagulant. But what about my quality of life? I hate the fact that these AF episodes come as and when. They make me feel awful. I'm then lying around waiting to decide whether to go to hospital or not. And the truth is, I don't want to take more medications. I don't want to take more medications because I have side effects. I'm worried about side effects. I don't want to have an ablation because I think that's a really invasive procedure and I don't want it. What else is out there? And so I was starting to think, well, what other options are there for patients who have recurrent episodes of AF? Obviously, lifestyle makes a huge difference, but lifestyle takes years. You have to change behaviors, etc. Is there anything else? And I chanced upon this really interesting paper by a guy called Lombardi, Lombardi. He published in the World Journal of Cardiology in 2012 in March. And the paper was entitled Acupuncture for Paroxysmal and Persistent Atrial Fibrillation. If you join my Facebook page, I can send you the link, or I can post the link on there. So my Facebook page is Your Cardiology One. Anyway, what these guys did, Lombardi and his colleagues, what they did was they took I think it was, how many patients were there? 31 patients who had paroxysmal AF. Okay, so 31 patients who had AF which would come and go, and they'd been having AF episodes for the preceding 6 months. They were already taking medications to try and reduce the episodes, but despite the medications, they were still getting AF episodes. And what these guys did is they said, okay, well, look, we're going to give you a diary, and we're going to ask you to mark how many AF episodes you're getting, and we're going to then also mark how long these AF episodes last. And then these people were put through a session of acupuncture. So they were given 10 acupuncture sessions of 15 to 20 minutes on a once a week basis. Okay. Now, I'm no acupuncturist, but what I can tell you is one of the reasons acupuncture could work is because we know that a lot of AF episodes occur because of autonomic imbalance, autonomic system being the finely balanced system between our flight and fright response and our rest and digest system. And usually AF episodes occur if there's a disruption or dysregulation of that. And that triggers off an AF episode. So with acupuncture, there are certain points which are thought to be more vagal. Okay, so they have a vagal effect, and by more having a vagal effect, they can actually regulate the autonomic nervous system a bit better. So there are 3 spots that these guys performed acupuncture on. One of them is called the Neiguan spot, which I think is around the wrist area, but I don't know much about this. And this has a vagal effect. There was another spot called the Shenmen spot, which has a calming and a sedative effect. And then there was another spot called the Zinshin spot, which is also supposed to modulate the autonomic nervous system. And what they wanted to know is that if you put these people through 10 acupuncture sessions, do their AF episodes get less? So they followed these people up over 10 months to see whether the people said that their AF episodes got less. And what was very interesting was that the AF episodes got less. The median number of AF episodes before was 15. At the end of 10 months, it had gone down to 2. The burden of AF, so the average burden, how long the AF episodes were lasting, was about 100 minutes. And by the end of 10 months, it had gone down to 6 minutes. So one could conclude on the basis of this very small study that in these people, acupuncture seemed to do something. It seemed to make them feel better. Now, this is a very small study, and if you did it on a much bigger scale, you'll probably find that the benefits are not as great as you can see in a small study, because, you know, bigger studies never show that kind of great benefit. However, we don't know when a bigger study is going to be done, because acupuncture is not going to generate a huge amount of money for the drug companies, and the drug companies would rather use the money to test their own newest, latest and greatest inventions. So what I'm trying to say is that if you are one of those people, oh, by the way, there were no real harmful effects from acupuncture. That's really important to tell you, that no one actually came to any harm as a result of the acupuncture. So if you are one of those people who's getting recurrent episodes of AF, you don't want to take more medication, you don't want to consider an ablation, but the AF is affecting your quality of life, then it's not an unreasonable thing. It's not an unreasonable thing, if it's affordable, to go and see whether acupuncture can help. If it does, and your quality of life improves, great, that's all you want, right? And if it doesn't, well, you've tried it. So I would love to hear from acupuncturists who may have had experience of treating AF, and I would love to hear from patients who have AF who've tried acupuncture to see whether it's made any difference. With all these things, you know, they're not commonly known because there's no big amount of evidence behind them, but then how will you accrue the evidence when there's no money in the system and no one's really interested? So sometimes what we have to do is just through dialogue, like through this channel, if people contacted me and, you know, everyone turned around and said, wow, it's the best thing since sliced bread, then that will build confidence amongst other people. So if you have had good experiences, please let me know. If you've had bad experiences, please let me know. If you're an acupuncturist, please let me know. And if you generally just enjoyed this, please let me know. I very, very much value your comments, and I would really, really, really appreciate it if you'd consider sharing the videos, because for me, you know, that brings traction to the channel, and that in some way makes it worthwhile for me. So if you could, I'd be very grateful. Please come and join me on my Facebook page, which is Your Cardiology 1. Finally, I would like to say that I'm going to be in York doing a seminar on the 28th of April at the Bar Convent. The details are on York Cardiology 1, my Facebook page. And I'll be in New York doing a seminar on the 4th and 5th of August this year. And again, if you happen to be around, please pop by. I'm there all day. We can meet, we can chat, I can answer your questions. So it's not going to be a hurried thing or anything like that. I'll be there. I'm friendly enough, and you can come and ask me anything you like. So if you can, I'd love to see you there. Thank you so much. All the best.